Today let's discuss about paragangliomas. Okay, these come under middle ear and mastoid tumors. They are primary tumors and secondary tumors we have. This is coming under primary tumor and it is a benign neoplastic tumor. Okay, ready? So I made it little simple only this time. Okay, it will be like katte kotte teche. Let's discuss. So paraganglioma, it is also known as glomus tumor, originating from the paraganglionic tissue. Paraganglionic tissue is from neural crust cells, right, which is ectodermal in origin. So migration will be along the parasympathetic nerves of the head and neck. So and they classified me based on my location, like carotid body tumors, jugulotympanic, glomus intravigal. Okay, carotid body tumor usually seen at the bifurcation of the carotid artery, common carotid artery. It bifurcates into internal and external. There we will see carotid body tumor, and jugulotympanic is tympanic branch of the ninth cranial nerve. Okay. And in the middle ear cavity, and glomus intravagal is vagus now. Okay, so microscopically I am like cell nests and sheets and ribbons. Okay, so two types of cells are within me. The tumor is saying that two types of cells will be within me. One is chief cells and another one is sustentacular cells. Chief cells, they secrete the catecholamines or vasoactive substances. Sustentacular cells are modified squam cells. So like we should be assuming in the version of the tumor. Okay, I am often seen in the middle age, that is 40 to 50 years. The tumor is saying she is a feminist, means females will be most commonly affected. That ratio will be 5:1. The tumor is benign usually, and it has no capsule. Normally benign tumors are encapsulated, so there won't be any spread of the tumor, right? But it is non-encapsulated. Okay, there is no capsule as such. So okay, based on the location we studied, and then so I grow slowly. I am locally invasive. I have good blood supply due to the presence of the numerous sinusoids within me. I don't have contractile muscle, so I bleed profusely. So this tumor is growing very slowly. Benign is slow growth, right? And it is locally invasive. It is not non-invasive because it has no capsule, right? It is invasive. It is free to move, right? So it has good blood supply due to the presence of the many sinusoids will be supplying, and it has no muscle, contractile muscle. If there is any contraction of the muscle due to the fibers, they will come closer and the bleeding will stop, right? So here that contractile muscle is not there, so it can bleed how much it wants, so it bleeds profusely, and doctors classify conveniently for their diagnosis and treatment as glomus jugulare and glomus tympanicum. So jugular is jugular bulb. Everything should be according to jugular vein, jugular bulb, jugular canal, jugular foramen, everything. So first floor of the middle ear cavity, floor में jugular vein, so it arises from the jugular bulb, and it also invades the hypotympanum, jugular foramen. Jugular foramen we know 9th, 10th, 11th, 12th nerves will be there. 9th, 10th, 11th will be enclosed in a common thing, and 12th will separate, right? So these nerve manifestations will be seen due to the compression of the nerves by the tumor, right? So and it may also compress the jugular vein. Okay, and it will find some place in the lumen to invade. Okay, it will also invade the lumen also. So coming to the so we will also like think like this, right? So how can I establish myself? How can I like that? So that tumor will also think like that. How can I establish myself? How can I spread? How can I establish my colony, like that? So and before that we have another thing, glomus tympanicum. It is arising from the that promontory of the middle ear, and oral symptoms will be there. Sometimes the patient will be coming with facial palsy. Okay, you should differentiate the facial palsy, why it is occurring. Okay, and so how can I establish, how can I spread? The tumor will think and it will start establishing its thing. Okay, so first will be middle ear, so it will feeling in the middle ear. From middle ear to external ear canal it is spreading, so it will perforate the tympanic membrane. It will protrude as a vascular polyp. It has high blood supply, so it will come as a vascular polyp, and it will bleeds profusely. And in the external ear canal it will present as a polyp, and eustachian tube it presents as a present in the nasopharynx, present as a mass in the nasopharynx. And it spreads to the even posterior cranial fossa, and internal acoustic meatus, and posterior cranial fossa, middle cranial fossa also. And it causes metastasis sometimes, very rarely, to the lungs and bones also, and mets to the lymph nodes. Okay. And jugular foramen we had already discussed, and base of the skull also it may invade. And 9th to 11th 12th cranial nerve palsy means, 9th cranial nerve is involved means what will happen, soft pellet involvement will be there, and pharyngeal muscles involvement will be there. 11th cranial nerve involvement, which is sternocleidomastoid and trapezius paralysis may be seen. And if 12th nerve is involved, half of the tongue will be paralyzed. The patient will be coming to the OPD with these such a presentations. Okay. So coming to the clinical features, actually to make it interesting we should start from the clinical features, and we should ask you diagnosis, so it will be little bit interested. So okay, it's okay. So intratympanic presence, the patient will present with the hearing loss, and some buzzing sensation, which is tinnitus, which is pulsatile sensation. Okay, pulsatile. The pulse, if we apply carotid pressure, so that tinnitus sensation will be stopped temporarily. Okay, it will be the synchronized with the pulse. Okay. Coming to the so otoscopic examination, whenever the patient comes like mass in the ear means, directly means, sometimes it will be visible as nasal polyp is there, like that. Sometimes we should see with the otoscope, right? So we'll keep the otoscope and we'll examine. Then there will be red reflex seen, and rising sun appearance. So if it starts arising from the floor of the middle ear, internal jugular will be there. If it is starting from that, so it will be like a rising sun. Okay. And it will make tympanic membrane will appear as a blue and bulging. Okay. And pulsation sign will be positive. Ear canal pressure will be increased with Siegel's speculum. We use Siegel's speculum and will increase the pressure. So then the tumor will pulsatile vigorously, and it blanches. And then if you release the pressure, it will again reverses, means the blanching reduces and the pulsations will reduce. Okay. The tumor pulses as the pressure increases, and pressure decreases means it will regain its normal, right? Okay. And sometimes, as before we said, and jugular, sometimes it may present as a polyp. Okay. Then tinnitus will be there, hearing loss will be there, profuse bleeding. Some profuse bleeding is coming from my ear when I try to clean it, or it may occur spontaneously. And sometimes the patient will come with dizziness and vertigo, and sometimes with facial palsy. Okay. And secondary to infection, sometimes infection also occurs, otorrhea, CSOM. With polyp, the patient may comes with the otorrhea polyp also, because due to some secondary infection. Okay. And examination, there will be red vascular polyp, as we saw numerous sinusoids will be supplying it, so it is very red and vascular. Okay. Normally polyp will be pinkish type, so it is red vascular polyp, bleeding readily, profusely. Okay. And cranial nerve palsy, it will present as a mass over the mastoid or nasopharynx. Audible bruit, auscultation, we should keep the steth over the mastoid and hear for the bruit. There will be systolic bruit will be heard. Okay. And glomus tumor, it will secrete the catecholamines. It is a neuroendocrine tissue, right? So it will secrete catecholamines, and is ectodermal in origin. So ear symptoms will be there, and some symptoms like headache and sweating will be there, palpitations, anxiety, everything will be there due to the catecholamine secretion. These symptoms are headache, sweating, palpitations, and anxiety. So and So it will follow the rule of 10. Okay, rule of 10, like 10% is familial, 10% multicentric, and functional tumors. So how will you differentiate? What is the differential diagnosis of glomus tumor? Means congenital cholesteatoma, adenoma, schwannoma of facial nerve, and hemangioma of the facial nerve. Okay, then internal carotid artery, high jugular bulb, choristoma like cholesteatoma only. Okay, normal tissue will be growing in somewhere place, abnormal place. So sometimes like a normal salivary gland may be present as a mass in the middle ear, okay, or non-neoplastic, and sometimes it doesn't grow, right? So what are the investigations? One is CT head. So to distinguish the glomus and jugular tumor, so CT head is needed. MR angiography or MR venogram will be venography, and CT head and MRI together can also be seen. And during the CT head, we will take some tissue biopsies also of the tumor to see the histopath of the means. To see how it is there, and 4 vessel angiography, jugular bulb, carotid artery, and if there is any intradural extension, we should see that vessels also, and brain perfusion and flow studies we should do. So embolization should be done. Biopsy is gold standard, and treatment will be surgical removal, radiation, embolization, or combination of radiation and embolization. Surgical removal either through transcanal approach or hypotympanic approach or extended facial approach, and extension facial with approach, master neck approach, temporal fossa approach of fish, and transcondylar approach. Okay, I just summarize like this treatment and investigations, everything. So if we write this much in the exam, it's enough, but if you want to write more, you can write about the differential diagnosis in each one, like high jugular bulb or hemangioma of the 7th cranial nerve. Those points, some points you can write, like choristoma, what we said, abnormal place, normal tissue is growing, like that. You can write one point, and treatment you can explain somewhat.